Hi guys, my name's Lacey. I will be talking about exercise and cancer, specifically lymphoma. Lymphoma is a cancer that starts in the cells of the lymphatic system, which is part of your immune system. As you know, your immune system helps fight off infections and disease, and it contains lymph nodes, vessels, and fluid. These are all over the body, so lymphoma can start pretty much anywhere. So lymphoma starts when a lymphocyte, either a B cell or T cell, becomes abnormal. The cell will divide rapidly and form a tumor in a lymph node. As I said, it can start anywhere and it can pretty much spread anywhere in the body. There's two main types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma. As you can see, there's a chart to the left that kind of describes the hierarchy of the different kinds of lymphomas. Hodgkin disease or lymphoma has two classifications. There's classic Hodgkin lymphoma, which is more common in young adults, actually. It's the most common cancer for young adults. This is when there are Reed-Sternberg cells, which are large abnormal lymphocytes in the nodes. Can be usually cured, which is cool. And then there's also nodular lymphocyte predominant Hodgkin lymphoma. This is when a specific mature B cell antigen performs as an idle B cell. This is pretty uncommon, but it does happen. As for non-Hodgkin lymphoma, there are many different types. On the left, there's a chart that maps out a lot of the most common NHLs. The two most common are diffuse large B cell lymphoma and follicular lymphoma. It's broken into B cell lymphomas and T cell lymphomas. For B cells, there's high grade and low grade, and for T cells, there's systemic and cutaneous. Causes. There's not a pinpoint cause usually as to why someone will get lymphoma. It happens when the genes of a lymphocyte change, and that usually stems from a immune system problem, maybe medications that they're on that lower their immune system, or specific infections such as HIV, which is very common in young people. Previous cancer treatments can also cause lymphoma, as well as exposure to benzene, which is a gas that was not well regulated as much as it is now as it was in the 60s. Symptoms. There's swollen lymph nodes, fever, night sweats, extreme fatigue, and unexplained weight loss. As you can see, these are some pretty common symptoms of other diseases and sicknesses, even just like common cold, flu, which is why a lot of patients go untreated for a while. It's because they are unaware of their diagnosis until probably at least the second stage. Treatment plans depend on the type of lymphoma, the stage that they're at, and the age and the health of the patient. That's pretty self-explanatory. You can't just do one size fits all. As for Hodgkin's disease, normally they're going to give you radiation and sometimes some biotherapy, but chemotherapy is used in the more advanced stages with medication. For NHLs, mostly they're going to give you low-dose chemotherapy, but some patients do have radiation and biotherapy as well. It is possible to cure lymphoma, which is cool. The survival rate for Hodgkin's disease is 85%, which is pretty high, and then the survival rate for non-Hodgkin's lymphoma is 63%, which is still better than 50-50. There's 4 stages of lymphoma. The first one is when there's a single cancerous lymph node. Stage 2 is when there's 2 or more cancerous lymph nodes on the same side of the diaphragm in close proximity of each other. And stage 3 is when there's cancerous lymph nodes on both sides of the diaphragm. Stage 4 is when the disease spreads outside of the lymphatic system and to the other systems in the body. Some considerations. Treatment side effects often worsen the quality of life. These patients are going through chemotherapy, radiation, biotherapy that take a really big toll on your body. It is going to worsen their quality of life. They're going to be so tired, and depression is probably going to be a big factor as well. Patients are also at a pretty high risk for developing thrombocytopenia, which is when they have low platelets. This is when they can bruise easily and bleed easily. So I would say avoid high contact sports. They also can develop neutropenia, which is low neutrophils. Avoid public pools and gyms, which you should probably do anyway, just because they do have cancer of the lymphatic system, which is part of the immune system. Their immune system is already being compromised as a result of their cancer. They're also at a high risk of developing anemia, which is when they have low red blood cells. I would avoid high-intensity exercise because they are going to fatigue even more than normal with going through chemotherapy, radiation therapy. Peripheral neuropathy is also a big issue. This is when there's nerve damage to the peripheral nervous system, so their hands and their feet are going to feel numb. So just be aware of unsafe balance exercises, such as, biking outside. So you can make some modifications that are fairly simple. Instead of biking outside, maybe bike inside on a stationary bike to reduce that risk of falling. Exercising with lymphoma, there's a lot of research on this. Aerobic training has been shown to improve cardiovascular fitness and body composition. Studies also show that sensometer training can positively impact these treatment results for these patients. It helps a lot with their PNP problems and their balance problems. Resistance training is important when maintaining strength during treatments. And evidence shows that exercise helps the treatment recovery as well. Lymphoma Association came out with this list of benefits of exercising with lymphoma. It's taken straight from their website. Increases bone and muscle strength, as I said, controls weight, lowers their fatigue, reduces their risk of infection while they're treated, reduces their risk of developing thrombosis or blood clots while on treatment because they're moving a lot and getting their blood flow. Also increases their overall physical well-being and their mental well-being and relieves some stress, which is huge considering that depression is such a big problem. My case study is on a 27-year-old named Amanda, who's a lymphoma patient. She was diagnosed with stage 2 classic Hodgkin lymphoma about 2 months ago and is currently undergoing treatment from her oncologist. She has been prescribed low-dose chemotherapy once a month and also low-dose radiation therapy every other day. She used to be regularly active before her diagnosis. She would weightlift and run. Since her diagnosis, she is kind of depressed, and she also complains of being tired all the time. Her oncologist also said that she has anemia since she started her treatments, and has cleared her for light to moderate cardiorespiratory endurance training, resistance training, and some flexibility and balance training. He thinks that she would benefit from some regular exercise as well. She is 5'7", weighs 128 pounds, has no family history of coronary heart disease, and her fasting blood glucose is 90 milligrams per deciliter. Her HDL levels are 45 milligrams per deciliter, and LDL levels are 110 milligrams per deciliter. She's not a smoker, and her blood pressure is 118/78. Because of her age, she's not at risk. She's female and she is not 55 years or older. Her BMI is 20, so she's not obese. She has a normal BMI. She is leading a sedentary lifestyle since her diagnosis, but before that, before those 2 months, she was active. She has no family history of cardiovascular disease. So she's not at risk there, and she's not at risk for prediabetes because she has a normal fasting blood glucose. She's not dyslipidemic. Her LDL and HDL levels are normal. She's not a cigarette smoker, so she's not at risk, and she does not have hypertension. Her blood pressure is normal, so she has no risk factor there. Her classification. This is taken from ACSM guide. This is just the risk classification. She is at low risk. She doesn't have any known cardiovascular, pulmonary, metabolic diseases, and she does not have major signs of cardiovascular, pulmonary, or metabolic diseases, as well as not having any cardiovascular risk factors. She does still require physician's clearance because she does have cancer, and she has been cleared to exercise by him with special considerations that need to be accounted for. This is the program I came up with. We incorporated aerobic, resistance, flexibility, and balance training. Aerobic-wise, I said to start out with walking and then progress into some light jogging. 3 to 5 days per week. Start at 3 days, progress a day, maybe every other week. Start at 20% of her max heart rate. Her oncologist really wants her to stay light at first, especially considering that she's anemic and she's going to be tired a lot quicker. I said to do at least 150 minutes per week, and she will increase 1 to 2 minutes a day. Resistance. I wanted to start her out with machines and resistance bands and get into some light hand weights later on, because she did do weight training before she was diagnosed, so she's probably pretty familiar with that. But just to be on the safe side, I would start with machines and resistance bands twice a week at about 50% of her 1 rep max for her lower body and 40% of her 1 rep max for her upper body. Start at 8 sets, or 1 set, 8 reps per set, and then I would gradually increase the amount of reps, the amount of weight, and the frequency a week, depending on how many pain-free sessions she will have consistently. Flexibility, she's going to be stretching before and after every session. She will stretch maximally but avoid pain, especially in her joints. Each stretch will be 15 to 30 seconds, and she will repeat 1 to 3 times. She'll increase this as tolerated. Don't want to overdo it, obviously. Balance, I think it's really important that she does some balance exercises, so I said yoga is a good thing to try. I would definitely do beginner's yoga once a week, just because she is at risk for having balance problems. I said not to increase the difficulty just because we don't want to put her at any unnecessary risk. Some other considerations, I would never let her exercise alone or unsupervised given her condition. Shouldn't with any cancer patient. Definitely allowed for down days, especially after chemotherapy treatments. She's going to be very tired. You don't want to overwork her. I would never have her participate in any high-intensity interval training sessions just because of her anemia. She's going to be very tired either way, and adding anemia on top of that is not going to help that situation. We don't want to discourage her by how tired she's going to be. I would not allow her to swim at all because she is doing radiation. Chlorine will irritate the radiation site. Also, just pools in general should avoid because of the germs, and obviously her immune system being compromised right now, it's just not safe. And with that being said, you got to make sure the environment is clean. It's probably smart to have the first week after a chemo session to stay away from the public gym at all costs, if not the whole time, if we can. Just make sure everything is sanitized and clean. I would always ask her pain and fatigue level, just pretty often, just to make sure that she's not overexerting herself. And I would closely monitor her signs. For overexhaustion, I'd also recommend finding her a workout buddy. This will help with adherence to the program, and I would definitely try to find someone who has had lymphoma, exercised during lymphoma, and beat lymphoma. It just kind of is a really good support system to have. These are the references I used. And that's it. Hope you learned a lot. Thanks.